Hi, everybody. I'm Melissa Kornhaus, licensed mental health counselor and the president of Professionals United for Parkland, a nonprofit group serving the mental health needs of the community in the aftermath of the recent high school shooting. I'm here with an amazing woman and also a board member, our community representative. Her name is Melissa Zucker. She's a licensed clinical social worker and a certified thanatologist, which you may not have heard, but she is a grief expert. It's not a common thing. There's not too many of them in the world, but we're so lucky to have her here. And she's going to share with you everything that you need to know as a parent, student, sibling, teacher in the community about grief today. All right, so Lisa, why don't you just start with kind of defining for us what grief is and lay some of the groundwork for this conversation.
Sure. Thank you for having me.
You're welcome.
When we talk about grief, especially after an incident like what we had with the tragedy at Douglas at the high school, there's a difference between what we see as typical grief in comparison with traumatic grief. And the way that you can see the difference is that most people have experienced some type of grief, some type of loss in their life. And a lot of times people are able to progress without any type of intervention. People seek therapy in the form of companioning, which is a concept that was constructed by Dr. Alan Wolfelt, where a therapist is a person who will bear witness to the grief that the person experienced and allow them to explore their path in a much less guided sense, but more as somebody to hear and to give feedback and to bear witness to the event of their grief process, where traumatic grief typically requires more intervention. And the reason for that is that we see people experiencing not only grief symptoms, but also symptoms of trauma or a delay in the grief process because of the traumatic experience that they've been through.
That's a really important point. Can you explain a little bit some of the symptoms of trauma versus some of the symptoms of grief, if they overlap, and then what you meant by the delay and what might be happening in this type of situation where we had a traumatic incident along with a lot of grief?
Sure. So when we talk about traumatic grief, there are a lot of similarities between we call it a typical, what's typical with grief, but we call it a typical grief process and a traumatic grief process. There are physical symptoms with both. There are tremendous amounts of mixed emotions, such as anxiety, depression, that come along with both, and also visualization, imagery. But there are some key differences when you have somebody who's experienced a trauma. The grief process is also impacted by what they've been through in their life. So what kind of supports you may have, or if you've had any traumatic experiences in your past, or any episodes of anxiety or depression, that would heavily influence how the grief process unfolds. It also depends, of course, on your relationship to the people who died. And if you were witness in the building to any of the trauma that you experienced, there are people who were not in the building who also experienced the same type of trauma, but it depends usually on their history and also their supports. So when you see a typical grief response, it doesn't always distort the person's identity in the world, where trauma heavily does distort their identity. A lot of times people will say, I wish I would have done this, I wish I would have said something to someone before it happened, where with a trauma response, it usually is more, this was my fault and I could have stopped this from happening if I had done something. We see a lot with typical grief being more of a generalized sadness, even though there are tons of other experiences as far as emotions that are felt, including anger and shock and all of these responses that we see. But sadness is generally the most generalized symptom of a typical grief response, where with trauma, it's more along the lines of fear and terror. So, grief can stand alone. You have a grief response when you have a loss, but trauma almost always involves some kind of grief response because it involves loss. So grief doesn't always mean that there's trauma, but trauma nearly always means that there's some type of grief process as well.
Yeah.
So,
I was going to touch on something there. We're talking a lot about trauma here and different experiences that people have had in their life previously and how those can connect. So some examples of different losses or traumas that someone might experience that affect them now, like what might those things be? Like a car accident? What are we looking at here for previous trauma and previous grief?
Sure, it really depends on the person. One thing that I am very clear about in grief work is that there is no linear path. And the same way that you can't predict events that are going to be more significant to one person versus another person. So two people could experience the same traumatic event and walk away with a difference in the level of resiliency or the level of traumatic impact and functionality in the world. And so it really is such an individual process, both with grief as with trauma. So it's hard to predict, and that's why we have to really assess each person and see if they have a greater need for intervention or if they can be helped through companioning with a therapist and also through peer support. I find peer support to be extremely beneficial, and some local programs include Tomorrow's Rainbow, which is equestrian-assisted grief support in Coconut Creek, which is usually children and teenagers, but they have services available, and also Bobby's Place through Healing Hearts. And the Children's Bereavement Center hosts a group at Nova, including Lift from Loss, which is for adults. Parents who have lost a child can go to Compassionate Friends as well. And so those peer support groups are all free community-based programs. Some of those are national. Compassionate Friends is a national organization, so people who are watching who may be from other areas and experiencing traumatic grief can seek those out in their own communities.
That's good to know.
And of course, finding a therapist who has training in grief work. It's not something that's covered as much in our coursework when we get our degree. And so there are people who are certified, such as myself, through the Association for Death Education and Counseling, who specialize their practice in grief work. And I highly recommend finding somebody who has a little more experience in the grief area. You know, we just touched on it, but I want to expand on delayed grief.
Yes.
When you have a delayed grief response because of trauma, and this fits in with what I was just saying. So there are a lot of therapists who are trained in trauma work by using things such as EMDR and the techniques to be able to resolve trauma, who may or may not have experience with grief. So in something like a mass violence, a shooting, where there is a high degree of trauma and grief to process. So my recommendation to people is typically to find somebody who is able to do both, or somebody who works in conjunction with a therapist who does the other. So if a grief therapist has somebody that they typically refer for the trauma work first, a lot of times trauma, the acute nature of the trauma, has to be processed before you start working in the grief work or alongside it. But we usually won't start with grief work if there's trauma that needs to be resolved.
Right.
So being able to do that first.
Yeah, absolutely. So basically, you like you said earlier, the trauma is a lot of the fear and the terror. And so you have to have that sense of safety and have to get the body a little bit calmed down and not always on edge. And then sometimes that'll unlock, and then it's more appropriate to do some of the grief work like you're talking about. And so how would you know, or what kind of questions would you want to ask a therapist, or what would you want to look for on a website to know if they're trained in trauma or grief work?
Well, you can look for what types of interventions they say that they're comfortable working in. We see a very high degree of people getting the help that they need in traumatic grief with people who are trained in CBT, which is cognitive behavioral therapy. There's also a lot of exposure therapy, such as with PTSD. But, you know, I think the best way is through a conversation.
Yeah.
You always want to find a therapist where you can pick up the phone and say, hey, can I talk to you for a minute and see if we're a good fit? A therapist is a relationship just like any other relationship in life, and there has to be the right kind of trust and chemistry for it to work.
Absolutely.
So Ask them what their history is as far as their ability to work with trauma and also their ability to work with grief, or what that usually looks like, and what their education is, if they've gotten any types of courses to update their education, so that they have awareness of the newer interventions that we use in grief work.
Yes.
So, yeah, I think that's the best way.
Absolutely. And I've heard from a lot of people, even already, we're just a couple months out from the shooting that happened, but I've heard from people already that I've tried talking with a grief counselor, I've tried talking with a therapist, and nothing's working. And that might be because the therapist isn't meeting what's happening for them right then. You know, like you said, sometimes the trauma needs to be addressed and really get that person feeling safe and a little more calm, maybe sleeping and eating somewhat, and then the grief work might come in. So asking questions even to a therapist, I'm a therapist, you are too, and we don't mind at all when people say, well, how many grief cases have you worked with? You know, or what kind of trauma do you normally see, and how long does it usually take to get me, or, you know, or get my child to be able to sleep and eat? You want to ask these questions and really get a sense that the therapist is comfortable and has actual experience, you know, and the training's important, but also that they've used it, you know.
I think a good question along those lines is to ask, what is the goal of those types of therapy? With trauma, the goal is to process through a lot of the physical and the emotional and mental symptoms of the trauma itself, the traumatic event, and the feelings that you're having because of the traumatic event. Where grief work is very much about, how do I learn to live alongside this? We kind of incorporate our grief into our new narrative.
Yes.
It's not something we just get over and get past. It becomes a part of our story. And you want to find a therapist who's comfortable with that. We don't work towards helping people to accept loss in the same way as it was previously taught, in the sense of losing the attachment to the person and just getting over it. That's not what we encourage in grief therapy. What we encourage is assimilation and continuing bonds, which is Dr. Phyllis Silverman. You know, how do we maintain our attachments to the person who's gone, but function in life? How do we move on with our life, but keep them present?
Yeah.
And you want a therapist who is not talking about linear stages, the 5 stages of grief and loss. We've moved very far beyond that. Dr. Elizabeth Kubler-Ross herself, who was the one who did the research and created the 5 stages, said that it was kind of misinterpreted in the mainstream. So it's important to find somebody who's learned some newer modalities and understandings of grief since then.
Yeah, and for yourself, as somebody who's experiencing grief, or as a parent of a student, it sounds like it would be really important to not expect your child to be going through a sequence of stages, and then if you see that they're not sad, or they've been angry and then they're sad, now they're back to anger, to think that something's wrong. So can you share a little bit, you know, some of what the specific symptoms are and what a parent can expect and what's normal versus when should I probably get some help?
I'm so glad that you brought this up, because we often see people judging or deciding if somebody else's grief process is right or wrong, and it's just not a good way to approach a grief situation. Everybody is different. There are some generalizations that we see in the research to be able to talk about it. Dr. Terry Martin and Dr. Ken Joga talk a lot about instrumental grief versus intuitive grief. So sometimes somebody will say, my child's not crying. I know they're grieving, I know they're sad, they lost their friend, they lost their sibling, but they're not crying.
Right.
What do I do? And some children process their grief, just as adults, process their grief in a different way. So they used the Carl Jung sense of male versus female. This is not a gender assessment, but intuitive is the more female, Jungian sense of female in the grief process, and that's the emotions. That's the person who's crying and who's talking about how it feels. And, you know, on the other side, on the male side, we have the instrumental griever. And the instrumental griever is somebody who has to do something. They experience their grief through actions. And so when you see somebody who starts a foundation or is going and engaging in speaking events, or who is very active in their grief, it's not that they're avoiding it necessarily. For some people that may be true, But typically it's how they're choosing to experience and express their grief. Yes, anger is a part of that. Yes, sadness is a part of that. But it doesn't mean that they're not feeling those emotions or doing that correctly.
Right.
Just that this is the way that the grief is playing out. And so what I recommend to parents, if you have a grieving child, and what I recommend to adults who have somebody who they love who's grieving, is to just meet them where they're at. How are you? What do you need from me? Can we go and get you some help? Do you need support in whatever way you're choosing to grieve? Programs that really have a tremendous amount of experience, like Tomorrow's Rainbow and working with children, it's a free program. And if your child is grieving and you want to get a feel for if they need more intervention or if they're really going through it a way that's healthy for themselves, just go. Go and bring them there. Let them be around other grieving teens or children. Go to Bobby's place if you're a grieving parent and go be around some other grieving parents and see, do I feel okay? If a group is not what's best for you, then find a therapist. And even just to see somebody once and process through all the individual feelings that you're having and the ways that you're concerned if you're doing it right or not, which is always what people ask, but there really is no right way to grieve. It's kind of a mess, and it's filled with ups and downs. We call this the dual process model, stroke and shoot, where it's a roller coaster. 1 minute you could be fine, and the next minute you'll get hit with grief like a ton of bricks. And we have to accept that along the grief process. Much further out.
And know that, and to know that, we don't need to judge ourselves or to judge other people for whatever mess we're in, and that you can be a guy and you can be very emotional and cry and cry and cry. And you may wish to do that in groups or you may wish to do that privately. Neither is wrong. And you can be a female who wants to take action and you're out advocating or speaking or organizing things, and you may not cry or spend nights, crying with your family or by yourself in your room, and that's okay too. And you can be anywhere in between and switch back and forth, and all of it's normal and healthy, right? And so what you were saying too is, like, if you're not sure if it's okay or if you need support or your child needs support, you can just check in with a therapist and establish that relationship.
It doesn't have to be an ongoing every week type of the situation. You can go and get evaluated and just decide, do you need more support? Does therapy feel like something that I want to keep in my life? Or, does the therapist, and do I feel that I'm doing okay on my own? Because, that's where grief can progress without intervention. Companioning is important, support is important, but traumatic grief typically requires more of the interventive type approaches where you really need some more direction. We always think of emotions just being, sadness means you cry, and anger means you yell, and it's not always like that. Emotions are a mess, just like grief is a mess. They squish and intermingle, and they're not just these clear-cut divisions of emotion. So some people might do well with journal, and some people might do well with art or music. And, you have to find the right path for you, what feels right for you. But that can be explored either on your own by trial and error. It might be what helped you in the past. It might be something totally different. I'm working with someone who has never been creative, and suddenly he discovered that painting is what's getting him through his process.
Sure.
It's you have to try some different things and see what feels right, and especially with the young kiddos out there, but with adults as well. We really burden ourselves with judgment and with picking up our bootstraps and trying to just get on with life and ignore what's happening. And grief is not something you can walk around. If you don't go through it, it's going to come back to haunt you, either emotionally or physically. People get sick when they try to just ignore the symptoms of their grief.
Yeah, I was going to ask you about that earlier because you mentioned physical symptoms. So what are some of the expected kind of common early physical symptoms, and what things can happen in the body later if the emotions or the grief process is kind of pushed away?
Right. So this is where we see a lot of overlap with trauma in my experience, as far as stomach pain, head pain, not being able to sleep, sleeping too much, not being able to eat, things like this, where it's so varied And it really depends on what the person has been through before, but also whether they're expressing their grief or they're holding it back. My concern for people is that if they let it go too long and they're not doing self-care and acting appropriately addressing their grief, that those physical symptoms begin to become the norm. That you suddenly become a person who never sleeps and never eats, and their body becomes worn down. And it can really have a significant impact as far as making yourself get pretty sick. When we don't slow down, our bodies make us slow down. It's important to check in with your own body and to decide, how can I supplement my life to be able to deal with what I'm feeling? So if you're not sleeping well, if you're not eating well, to find different things that might work for you to be able to do a little bit better with self-care. One of the most important ways that I encourage people to start is with breath work. So learning how to do the right kinds of breathing, whether you go to a yoga class, a meditation class, working with a trauma specialist who has a lot of ability to guide you in stress management and breathing techniques, it's important to start to allow your body to adjust, in addition to dealing with the emotional side of grief.
Right, right. You do create, after grief, it sounds like you do create a new normal, and that you may have alongside of you this sadness or this loss or all of these reminders of this person that was there, or this even, grief in the sense of this school that I had in my mind as being a safe, beautiful, happy place, and now it's something different. I've lost that ideal I had about the school or about the safety of my community. All of these are losses and things that we grieve and work through. So you find a new normal with what you feel around that and what your relationship with that is. But it sounds like you don't want to find a new normal with regards to, well, I just don't sleep anymore. And I just always skip lunch now. And I get migraines every week. And, that's just life now. Like, that doesn't have to be that way, right?
Absolutely. And you brought up a really important point. When we experience a loss, it's not one isolated experience of loss. We lose the person. We lose our sense of who we are in this world in comparison with that person. How many children do I have now? Do I still say I have, the same number, or what do I say? We lose the ability to feel safe and secure in our environment when we've had something so tragic happen in our school. And the community is impacted, but the individuals are impacted, and it's important to see that it's not just one loss. So we call this multiple losses. If it becomes too much, we call it bereavement overload, which is very similar, I feel, to what trauma is about. When the system kind of shuts down because there's too much for the body to handle. And so when you're experiencing multiple losses, you may grieve those in very different ways and also in a different period of time. We talk about the new normal, adjusting to life. I feel that every loss of a person or of something important in your life is a scar. That in the very beginning, it's open and it's raw and it hurts every single minute of the day. And over time, we begin to develop a little bit of a scab. Not that it becomes any less painful, just that it becomes different. It becomes something that we carry with us. A lot of times, depending on the type of loss, who the person was, we can transform that into resiliency, into something beautiful. The reason I do this work is because of my own grief history. And so when we're able to take something that we've been through that has been traumatic and has been hard, and we can create it into something that becomes a part of our life and a part of our identity that helps others or that helps ourselves, it's the best thing that we can do to move forward.
Yeah, so some of those things might be that you find a new passion and a new compassion and way to help people and serve people. You may be able to form new relationships with people that now you have something new in common. You may learn how to take care of yourself in a totally different way that before you never had to, you could get by. But now you've got a hobby or an exercise or a breathing routine or just checking in with your body that can be new and really empowering and strengthen you in your life to move forward and to be an even more dynamic, happy, engaged, fulfilled person, right? Along with this grief or this missing hole, right?
Definitely. Yep, absolutely. It really changes who you become in the world. And one thing that you said is finding people who you can form relationships with. It's so important. They say that grief rewrites your address book. The casserole brigade that comes around the first week, not everybody's still going to be calling in a few months. And people that you didn't know or didn't expect are going to rise up out of the woodwork. Professionals like ourselves who have been connected through this tragedy that are now able to support in greater impact on our community because of what we've all experienced. There is a lot that can come from it. Sometimes it feels very isolating when the people that you thought were going to support you and were going to be there for you back away because they don't know what to say or because they want to help you. But if you stay open to it and if you're out there doing good for yourself, you'll find that there are other people who want to be a part of that narrative with you, who want to be a part of your life and your story.
And that can be another sense of loss too, right? The change in the relationships. Like now you just don't feel like you understand each other the same way because of what you've been through and how they do or don't understand. And that may be another layer of loss, and kind of letting that go and accepting what is. And then, like you said, opening yourself to new connections maybe. And instead of getting stuck in the anger, of course you can be angry, you can be frustrated and allow yourself to feel it, but also just know that this is part of the journey of grief. It's a new normal. Like you said, it changes your address book. I love the way you put that.
Yes, yeah, it really does. It changes all of your relationships, even within family and, with people that you never thought would be different. You see somebody who's lost a spouse or somebody who's lost a child or a sibling. The relationship, the people you used to go out with might be different because the dynamic is so different, because the numbers are so different. Getting that table for fewer people or not having your sibling there to talk to about things that you used to talk about, the spouse, couples, inviting you out, and now you're there on your own with them. It's a really challenging experience, and the loss from that can be a big impact in somebody's life. So it's important to try to find out what you can do to supplement the path forward and to make it different and to have control over it, to decide what you want. We don't see grief as this passive thing that happens to you. I mean, we experience the emotions, whether you want to or not, they happen to you. But what you choose to do with your grief, how you choose to move through it once you're past the acute period and you're able to have some direction. Do I want to be involved in something that relates back to school violence, or do I want to be involved in something that they were passionate about instead? Those things are entirely up to each individual.
Yeah. And from what you're saying, I also want to say it sounds like it could be really important and valuable and not strange if somebody suddenly needed to go for couples therapy or family therapy, because some of these relationship dynamics have changed and you have to find a new way to understand each other and to still meet your needs.
Yes, and this is where we need to break down stigma, because there's so much stigma associated with going to therapy that it means something is wrong. I had a patient say to me, "You don't stop watering a plant just because it has flowers." It's so important, even if you think that you're getting better, that if you think that there's some guidance or some support that could help your family or yourself to move through this process in a different way, that you reach out for it. It doesn't mean that there's something wrong with you. It doesn't mean that there's something wrong with your child or that things are not being done in a way that's most beneficial for them. It's more of a check and balance to make sure, are we doing everything we can? Is there something we hadn't thought of? And how can I get the support? We all need support in this world. Nobody goes through anything alone. And you have to be able to reach out for that if it's not readily accessible to you.
Yeah, absolutely. And, maybe from this conversation, I have two big takeaways, and then I want to give you the chance to share one message you really want to drive home. For me, what stands out is one, not being judgmental and kind of just accepting and going with what's happening and checking in with yourself and deciding what you need or what your child needs and their support. So not being judgmental. And then two is being patient, right? It's not like this is something that we're going to fix or we're going to get over. This is a process, and that's okay. You're going to be okay. Your child's going to be okay. it's one step at a time and it will continue to evolve. And there's a lot of hope for the growth that can come from it. So what would you like to really drive home from this conversation for people in the community?
Very much along those lines, just that there are people out there who want to be there for you and to support you. You have to reach out for them. Professionals United for Parkland is a great resource to be able to access services that are pro bono, that are free, and also some paid services if the supplemental care that you need is something that would require a cost. But reach out for the support that you need, and most importantly, be patient and kind with yourself and the people around you. This was not something we could have ever truly prepared for. Nobody ever thinks that something like this can happen in their backyard. And unfortunately, it's here, and we need to be able to hold each other up as we continue to move forward.
Absolutely beautiful. Well, thank you so much, Lisa. Such valuable information. If people have any questions, is there an email address they can contact you?
If they want to reach me directly, you can email me at Lisa, Lisa, M as in Mary, Zucker, Zucker, @gmail.com.
Okay, perfect. Good. Well, thank you so much, Lisa. And I know that this information will be really valuable to the people who have access to it.
Thank you.